Hi, everybody. Really, really glad to see you all here and so fortunate to have today's guest with us. We have Dr. Tom Moorcroft, who is an infectious disease expert. Hi, Tom.
Hey, how are you?
So good, so good. So Dr. Tom is here from, well, he's there in Connecticut. He's not actually here. He's here on my computer screen. And I asked him to come in here today to chat because there's just so much information out there. We're all following it, right? Like we're just inundated. You can't open your inbox, your social media, the news, anything. It's just coronavirus, coronavirus, coronavirus. And to really understand this situation gets very, very challenging because we're getting mixed messages all over the place. You have some people like just in sheer panic, others saying, this is no big deal. And so, I had the great fortune of hearing Dr. Tom really help us navigate. It was a group of health practitioners. He was helping us just kind of lay the landscape. And so I asked him if he'd come here and do that for all of us. And he very generously agreed. So thank you so much, Dr. Tom. I would love it if we could just start, let's kind of lay the groundwork. What is the situation that we're in right now? What is it that we do know? And what is it that we don't know? Because this is such
Oh my
foreign
God.
territory, right?
Yeah, right. I mean, it is. And I think foreign territory is really important. I mean, we have some information from previous pandemics and previous coronavirus things like SARS and MERS, but we haven't seen anything like this before. So I think a lot of the reason we don't understand what to do is we're not prepared because we haven't seen it. And one of the things that's interesting, and unfortunately, like I think the medical community the conventional medical community has done a good job at being calm and saying, don't just run to the emergency room. These are the things you need to do. But unfortunately, our leadership in politics, and as a physician, I try to steer clear of making public statements on politics because it's just, never a good idea. But we're just not showing good leadership. And this doesn't just have to do with the current administration and politicians, but we have never really planned well for this kind of thing. And so we're in this situation of most of the answers are, I don't know. But the good news is we have a lot of science, and we do have people who have looked at these possibilities and what we learned from these other things, so we can learn a lot of new information and at least come up with a good response. I mean, right now we've got almost 154,000 confirmed cases in the entire world, with approaching 6,000 deaths. I mean, the United States just today topped 3,000 cases. One of the issues with that is getting information out to people has been slow. Like the CDC doesn't update over the weekend.
Right.
So if you look at the CDC, because the government says, go to our website, make sure this is the most up to date. Well, it is, except on the weekend.
Right.
So then people don't know. And so that's kind of a challenging thing. Another piece of what's going on here is we are at a point in the US, kind of like where Italy recently was, where the number of cases that we're having in any given time is doubling every 2 days.
Wow.
So we've hit that inflection point to exponential, and so there's probably two reasons for that too. There may be even more, but number one is we're doing more testing, which is a good thing. So we're identifying more people with it. So that would be technically an artificial elevation in the numbers, because it's like we're starting to count more people who actually truly do have the disease, but we're still woefully under testing. And the other probably more significant reason we have this exponential increase now is the fact that we're actually getting significant disease spread. So they're kind of the two big reasons.
Well, I don't know if that's encouraging or discouraging. It's encouraging that I'm hoping, I'd love to actually talk about this, the lack of testing that's available. I know, I have personal contacts who have been in a situation where they could have really benefited from being tested. They had some of the symptoms, but because they were younger, because they were not deemed severe enough cases, they actually weren't tested. And this is people that, had severe respiratory distress as well as fever. And so if those people aren't getting tested, and, I know a couple of these cases just personally, how, what's happening? How are people how do we know do we even have a sense? I mean, or is it just still just scratching the surface at this point?
Well, part of it is, again, it goes back. It goes back to some of the leadership issues is the United States likes to make our own testing.
Okay.
Whenever something comes out. So the CDC attempted to do this in January. They rolled it out. It turned out to be, there's some issues with it. It wasn't as valid, there's some issues. So we're getting false readings. Then, so that was into the beginning of February. Then we had a couple of weeks where there really was almost no testing available, very limited. And then towards the end of February, we started to roll out where LabCorp and Quest were allowed to start doing it along with the CDC, and they got their production caught up. So but even right now, there's much more testing available, but we do not have enough to go around. And back in the beginning, the WHO offered to give us their testing kits because they have a lot more available, and we said we're going to do it ourselves. So in the future, we might want to reevaluate how we do that for the next thing that comes around. But with testing now, there's a couple of issues, and one is the medical system is not prepared for this. We are completely overwhelmed, and it's probably going to get a lot worse. So we can't have everybody flood to the hospital, because then we're just going to infect everybody at the hospital and overrun the critical care units and the emergency rooms where we really need to put the most severely ill people. So if we step back a moment, what are the options and what are people recommending? And the number one thing is, if you have a fever, cough, or shortness of breath, stay home and then call your doctor. Don't go to the doctor, stay at home and call them. The only time that I wouldn't do that is if you do have severe shortness of breath, where you're like, oh my God, I might not be able to make it another couple hours like this. That's when you call 911.
Okay.
And you get the ambulance there. So what's happening is when you call your doctor, you should call either your primary care, or your urgent care, or even the local emergency room. They're going to, or at least most places, they're going to talk to you over the phone and try to make a recommendation of what to do. This is particularly helpful if you call your primary care doctor, because they should have a relationship with you. Right. We do know that in the greater Seattle area, hospitals in Vermont, and even some doctors I know are doing it in New Jersey now, as well as in Connecticut, where I'm at. We're actually setting up drive-through testing areas. And this is what was done in South Korea that really led them. I mean, they have a ton of more cases than we do at the moment, but we're looking to surpass them, unfortunately, quickly. But they are doing, the number of tests that they do in one day is what we've done in the last 53 days.
Wow. Wow.
Right? So we are worlds behind the rest of the globe. So, but they have set up drive-through testing so that they have healthcare providers who have the proper equipment to protect themselves and also protect others, who then will come to your car, talk to you, likely not even have you leave the car, test you in the car, tell you what to do until we have your test result.
Okay.
And then you go back home. That way we're not overwhelming the system. And so the sort of innovative ways to offer testing, and then the testing hopefully starting to catch up more and more, is going to be a really critical thing.
Do you have a sense of when here in the US we're going to be caught up in terms of testing? Like, do you have, I don't know if that's a fair question to ask of you. Maybe I'm asking you to.
No, I mean, from what I've understand, we're nowhere near there. I mean, and I try not to be an alarmist. I'm generally very much take care of your health naturally at home, go to the doctor only when you have to, unless you're going to your functional medicine practitioner or your health coach or whatever, your nutrition practitioner that helps you take care of your own health. This is a situation where we need to marry both sides of that aisle and really come to the middle, where we need to use our conventional system and our sort of more natural providers together. And I think that the problem with the testing is, so I'm always sort of erring on the side of the natural side of things. And I try not to be alarmist, but this is something that is completely different than anything we've seen in our lifetimes. And it's, unfortunately, I see that we're getting sort of the messages on really both spectrums on either side. And it's really, the truth is in the middle. You have a lot to do. Every person has a lot they can do to boost their own immunity, but we are going to need to rely on this. And the testing is something that, unfortunately, I think is going to be lagging for a while.
Okay. Well, let's talk about some of those things. Let's, make sure we can give people some things that they can do. And so, what do you think are the most critical things we can do? And I want to divide this question in two. I want to talk about those things we can do to protect ourselves and, and our families. I also want to talk about what we can be doing to protect others, because I think that's one of the biggest pieces here, is that this isn't just about ourselves. It's really about trying to contain and trying to protect those who are most at risk. And this is a different way of thinking than we've had to historically. So can you talk about that?
This is, Margaret, this is an amazing question, because most people are saying, how do I protect myself? Mm-hmm. And the reality is, from the very beginning of this, I've been saying the biggest problem we have is it's really hard to protect yourself because you're relying on someone else to protect you for them. So masks are a great example to kind of start our dive here. Is the mask, almost nobody other than a healthcare practitioner who actually has had an N95 mask, which is a special medical mask, fit properly, is going to benefit from wearing a mask. Right. Personally. All the dust masks, all the surgical masks, they don't filter small enough to protect you from the virus. And even the medical mask that I just mentioned, the virus is smaller than that filters. Wow. So there's estimates all over the place, but it's probably like 50% effective if the mask is fit properly.
Right.
Now flip that and say, hey, I put a surgical mask or a dust mask on if I'm a person with a cough. Now you have a better chance of protecting others, because the virus is spread primarily through respiratory droplets, right. Meaning when you mobilize secretions from your nose or your mouth when you cough or sneeze. There's maybe some other ways, but this is vastly the way it's happening. So now if I'm hacking, I can actually help minimize the spread of the fluids containing the virus by putting a mask on. Right? And this is where social distancing comes in, right? I mean, the reason that we want to be at least 6 feet away from most people, especially people coughing, is that's the average distance the respiratory droplet will go. Okay. Doesn't mean it won't go further or shorter, but it's something to think about. Yeah.
So to clarify, masks really, and I understand that there's a shortage of masks too. Yeah, we want to make sure that we want to make sure that people who need them can get them. So unless you yourself are coughing, and or you're a healthcare worker on the front lines dealing with these things, and it's fit properly, like just don't. As you see people who are flying, who are using masks, you see, and I can understand. You sit in I don't know that an airplane would be my most preferred place to be in this moment. And you want to do something, so I'm sure it feels good. But we also want to make sure we're not diverting resources from those who really need it.
That's really the big thing. We're actually, some of our colleagues on the front lines in areas where they're seeing patients are literally saying they don't have enough gloves. There's a shortage of gloves. Oh my gosh. Right? So now you think about, like, an airplane is a great example. I mean, the airlines have made huge changes. I just recently traveled. I heard one person cough all day going from the East Coast to the West Coast. I heard no one cough on the way back. I mean, it's almost the safest place to be, except for some asymptomatic maybe transmission, which we'll talk about, I know. But what they're doing is they're disinfecting everything between. So the seats are being done, the hand, the drop down trays, they're all being disinfected in between every flight. That's a really good move. But part of the thing is a lot of people are putting gloves on to prevent transmission, because there can be some contact. So like if I cough on the table, I wipe my hand on it and then I rub it in my eye or my mouth, I could get sick. Or I could transmit it to you if I high five you and then you do that. But the problem is, the glove, it doesn't protect you from sharing it with a different surface. So, we're going overboard with a lot of these things. The glove will protect the person wearing it unless they touch themselves. or I see a lot of people pulling their luggage and with the glove, and they're wearing the glove, and then they go wash their hands on the airplane with their wipe, and then they're good, but then they go in their luggage that they had just touched with their glove.
Right.
So we're just it's a bit of overkill, right? So we need to just focus on the things that are really going to work. And I'm not saying don't have heightened awareness, but some of these things that we think are helping are, like you mentioned, taking resources away from people who really need them. Yeah. And we're going to end up seeing mask shortages and more glove shortages. And we're even going to end up potentially having shortages of healthcare workers, because people are going to get exposed because folks are just going to flood the ER and the urgent care without calling. And all these healthcare workers are going to get exposed. And are we really going to realistically be able to quarantine everybody for 2 weeks? Right. And we know that just because I tested you today and you're negative for corona doesn't mean you didn't pick it up at work tomorrow. And right. It's a challenge.
So what are the top things we can be doing to protect? Let's start with ourselves. What are the top things we can be doing to protect ourselves?
Yeah, so I think there are two categories, right? And one is the obvious things that we need to do, which are wash our hands with soap and water for 20 seconds at a minimum frequently. And I even did a thing on the airplane in the bathroom the other day where I was like, hey, when you touch all the things on the sink, a lot of times, it goes off. It's a timer, but you need to push it. So use paper towels to touch sinks in public, but wash your hands before you use the public restroom as well as after, not just after.
Good thinking.
Right? Because you just touched all the doorknobs and everything to get into the bathroom.
Right.
And now, and so then it's a little extra hand washing. Now, we can use the alcohol hand sanitizers if hand washing is unavailable. At least 60% alcohol is what we know at the moment. The one thing I would say about this, though, is minimize. 2 reasons. One is we're going to run out and we're going to need it. But the other one, and probably more important at the moment at least, is that you're drying your hands out if you use it frequently. Mm-hmm. And the more we dry out our hands, the more we break down that amazing protection our skin provides us. Right. So we don't want to be opening up cuts. We don't know that that's how it's transmitted, but there is some evidence that, it could be even transmitted in urine and feces at the moment. Very small, but the risk is potential. And with everything evolving so quickly, we just want to minimize that. So the other thing is in the evenings or throughout the day, use some hand lotion. Not often, because we don't want to be caking stuff up on, it can get over control, but just once or twice a day, just to keep, with all the extra hand washing, to keep your hands moisturized, like maybe before bed. The other thing, obviously, is stay away from sick people, as best you can. So social distancing is important. I've actually, in the very beginning of all of this, I said, we don't need to go crazy with social distancing, but we need to use common sense, but keep an eye out for what's going to transpire, because it's looking like we might need to modify. And as over the last 2 weeks, I think that we really do need to significantly modify. I mean, we're closing our office and doing everything virtual for the next week or two at least, and then we'll reassess. I'm really happy to hear a lot of the school closings, and a lot of things like Nike and Apple have announced their closing. And is it a little overkill? I certainly hope so. But if we do not want to end up in a situation like Italy ended up in. And so our government's been taking kind of wishy-washy action. It's nice to see people taking big action. Right. And so that's really keeping us away from the people who are sick. And if you have to go to the store, do it really early or right after they open. Or if there's a big, if you're in an area and there's a whole bunch of people, leave and come back a little bit later. Or if you're waiting in the line to pay for your food, give some extra space. And if somebody cuts you off, don't worry about it. Just give yourself a little bit of space. And then the third thing, big thing, is that we have, because it's primarily respiratory droplets that transmit this, we have to consider how long it could live on a harder surface, right? And so any of the high touch areas like doorknobs, keyboards, things of that, maybe countertops, these need to be washed down at least once a day. And if you're in an area where you're like in an office setting, like maybe a doctor's office that does primary care or an urgent care, and you can't close, that's an area where you're going to want to have those areas cleaned more frequently. Now, one of the big things that's been talked about is, what about if I get packages? Because everybody's ordering stuff to come to their
Yeah,
house.
totally.
And coronavirus, in the beginning, we were saying it could be infectious on a surface from anywhere between a few hours and maybe up to 2 days. There's some newer research that's suggesting that might be even a little bit longer. And so the more sort of smooth and solid and hard, like plastic or metal, that surface, the longer it can be. And I've seen estimates even up to 9 days.
Wow.
Mm-hmm. So those are surfaces, though, that you can clean.
Right.
So I'm not even going to wait for 2 days. Now, one of the big things that just came out too is we're looking at cardboard boxes.
Yeah.
And we're looking at it could live potentially up to 24 hours. Now, so what I'm suggesting is, like, let's say you get your Amazon box, which I'm sure a lot of people are doing that.
100%.
Find a spot where you're going to have a containment area. Like for me, it's just going to be the front porch or maybe one side of the garage, because I don't want the stuff, once I open it, I don't want it blowing around and littering the planet. So, but what I'm going to suggest is, if this would be a time to wash your hands and have like the knife or your scissors that you're going to use exclusively for this. And then you just open the box. Now you open the box and now go wash your hands again before you go inside the box.
Okay. Yeah.
And then take it out. Now the question is, could it be, we could dive really deeply into Insanityville and go, well, it's the packing plastic and the this and that. It's possible, but what we want to do is, like, what are the areas where these things are being touched the most? And we may want to just leave the package, in the garage for a day if it comes in plastic. But if it's wrapped in plastic, it's nice, you can just wash it off.
Right. Totally.
So I don't want to suggest we have to go super crazy, but these are some tips that if you have someone in your home or a family member that you're sharing with that could be someone who's at a higher risk, right? So the risk factors are over 60 and chronic medical conditions, including asthma, lung diseases like emphysema and COPD, as well as like diabetes, especially uncontrolled, heart disease, and smoking.
Okay.
So as a few, and there's obviously more, people with cancer, people with autoimmune conditions that may be anything that's a medical condition uncontrolled, you're at a higher risk. So you might want to, do a little more of these things.
I want to dig into that because a lot in our audience, definitely with the autoimmune in particular. But you said uncontrolled. So if somebody is basically, if they're in the middle of a flare, for example, with autoimmune, that's going to be a different situation than for somebody who is, who's, in remission. It's something that they're mindful of, but they're doing the things and they're feeling generally strong. Is that the case, or do both of those people have to be extra cautious?
Well, the honest truth is we don't know.
Okay.
But what we do know is that the vast majority of people who are having really severe symptoms aren't falling into the autoimmune category.
Okay.
Smoking coming out of China is like one of the biggest ones.
Interesting.
And certainly obesity. Yeah. But what I would say is, like, I look at my autoimmune people in a couple categories, and I think the people who are most sort of balanced and remission are probably the best.
Yeah.
Obviously. And if they're working with people like us, even better, because we're probably getting into remission, not only because we're using conventional medical, but we may not even use any of that. We're using all the natural immune boosting things. The reason people get out of remission when they do all these natural things are because we get rid of all the toxic things that are triggering the autoimmunity, and then we're boosting our body. We're giving it the fuel and the raw materials it needs to be healthy. So a lot of people who are in that boat are already doing a lot of the things that anybody should be doing to help. The other group are going to be people who are sort of autoimmune on the downslide, meaning they have low immune system function. They could, I guess it's a little, so we could have people with like HIV or even primary immunodeficiency, which are going to be different than our autoimmune category.
Right.
But in that case, we're going to be wanting to bump people up. But then we have like sort of the hyperactive immune people, which are more the autoimmune. And I think within the last pieces of that category, we have the people who are more of like our Hashimoto's and our Crohn's type of folks. And they're people where I'm going to want to be a little more, concerned. I'm not going to freak out based upon the evidence we have so far, but they're the ones who are going to want to get a little more strict with their diet, a lot more strict with their sleep, and be on and exercise more social distancing and just common sense, including fresh air and stuff like that, which I'm sure we can dive into. But then there's this other group. I see a lot of kids who have autoimmune encephalitis, like a panda's pan situation. They react oftentimes very much like children with autism, where they're not getting common colds. If they get exposed to strep or Lyme again, they might go ballistic. But if they get the flu exposure, they're like, no big deal. So it is possible that if you're in a hyperimmune state, it might protect you a little bit. But again, this is something that we don't know. So I would assume that even though I tried to break apart a little bit of all these different categories, the best things to do are to naturally boost your immune system and not be exposed.
Right. I think that I couldn't agree more. And I feel like this is the time, if there's ever been a time to get your sleep, to move your body, to get some fresh air, to practice mindfulness, which is really extra hard right now, of course, because there's just like, it's really easy to spin out, but to really kind of double down, to, as you said, be really strict with the diet, follow the protocol that your provider has put you on, in whatever way, shape, or form that is. Oh gosh, I had a thought and then I lost the thought. 1 second here. Well, I want to, let's dive in. The thought will come back. Let's dive into actually a little bit more about this social distancing, because it's something that is very unfamiliar for most of us. And it does go against the natural instincts in a lot of ways to kind of lean in when there's an issue rather than leaning out. And I'm thinking in particular of people who have loved ones who are in that 60 plus, or especially, we have, some friends here with, parents who are in, elder care facilities, and it's exactly when you want to be running in, and that's exactly what we really need to not be doing. So can you talk a lot, and we also, both of us, we have kids home from school, all they want to do is hang out with their friends. So can you help us navigate this a little bit?
Yeah, well, I think, so to set the stage for that, couple of things, like you pointed out, the age over 60 is important. But if you were to look at the trend of, say, starting over here at little kids at 0 to 9, problems with coronavirus really, really low. Then you go to 10 to 19, and then you go 20 to whatever. So you keep working up, and then you get in your 40s and 50s. There's a little blip in terms of symptoms and mortality. When you hit 60, it blips up a little bit. So that's where they're saying, hey, watch out. But the interesting part is the difference between 50s to 60 and 60s is not a big deal. But when you hit that age of 70, it bumps up.
Okay.
And then when you hit 80, it's way up.
Yeah.
So 80 is the average age of death across the globe at the moment. I'm sure it'll switch a little bit, but it's important to understand that there is a huge age component. And as we were talking earlier, I was down doing a news piece in Manhattan, and the reporter off the air asked me, hey, my family, my mom and dad live in Florida. And this was, 4 or 5 days ago. And she said, they both have diabetes. And, my family, my 2 young kids, they've been going to school in New York City and everything, but we want to go visit them this weekend. And we have a trip planned. And she's like, well, what should I do? And I was like, no. And it was funny because most of the questions she asked me, I was just like, well, I don't know. Maybe let's consider this, try that. And that one I was 100% no. And the reason I said that was there's evidence that coronavirus is very much like influenza in the sense that you can have what we call asymptomatic viral shed, meaning you can have the infection in your body and show no symptoms whatsoever, and you can already be giving it to someone else.
Right.
And we also know that kids seem to, 1, be more resilient to it in general, and 2, if they get it, have much less symptoms. So we could have, and how many kids aren't a little snotty or a little off during the winter months now? So the problem is you can take your little kiddo over to see grandma and grandpa, and you can make them very sick, so it's and even those of us who spend a lot of time staying healthy, like my father-in-law, he's got some really significant cardiovascular disease and his heart doesn't pump as well. He did a lot of crazy things throughout his life, but about 20 years ago, he made all these changes, but the structural damage to the heart was done. This guy for the last 20 years has been the picture of functional medicine, daily qigong and yoga, de-stress. He does everything right now. And we're not going to see him. We'll FaceTime him or Zoom or whatever, because we could if we're sick, but we don't know it, like we're like a Trojan horse. And so we're making these hard calls that when we have people in our lives who are potentially at higher risk, like you said earlier, one of the biggest things is we need to be protecting other people, and hopefully they'll be protecting us.
Right.
So that's really the thing with social distancing. Is it started out with that 6 feet so somebody can't cough on you, but now we're saying, hey, we really need to contain this. We know that the data out of the countries like China and South Korea, where they've initiated a lot of this, it has really made a huge difference. And, Italy kind of got out of control before they started doing it. And hopefully it's going to really catch up and help. But it is weird. And even the word, why do we call it social distancing, right?
I know.
But the general population probably gets it. But again, it puts that negative connotation that I have to distance myself from you. And it's like, and then we're doing self-quarantine. And then if you have it, self-isolation. I'm like, wow, this is really powerful negative language.
Right.
So we need to think about it differently and come up with new opportunities to communicate with each other and stay in touch. But we really do need to give space, especially to those who are in those higher risk categories. But the problem is people who are relatively healthy are also dying, and we just don't want to be transmitting it through the population any quicker than we need to, because you and I might be in great shape and we give it to one person, but then that one person doesn't live their life like we do and they give it to 100 people.
Right.
So it's a tough one, because I want to say go outside. Oh, important. And you said this, I still go outside. I still walk the dogs. I think that when you talked about the best things to do, one is to stay calm and not go crazy on this one, but we need to definitely be getting, as adults, 8 or 9 hours of sleep, and our kids need more. And sorry to everybody who thinks you can get by with sleep less than that. The research shows that you're wrong. I'm sure there's 1 or 2% of people who can pull it off. Don't try to prove me wrong at this point in time. Get some more sleep. We need to get, like, whatever the diet is that's right for you. I'm a person who's all about a whole food, plant-based diet first. I eat a lot of meat. It makes my body feel good, but I'm still I'm like a, what do they call them? Vegetarian?
Vegan.
Huh? A pagan.
A pagan.
Whatever, yeah. I'm just like, but it's interesting. If I get all my rainbow color of veggies, yeah, and a moderate portion of red meat, my body does best. I know that. But we all need to be doing the veggies first. And then the part about getting outside and getting some fresh air is so critical. If we look back at our previous pandemics, we've only used that word a few times in the last 120 years, right, like 4 or 5. So if we go back to the Spanish flu pandemic, osteopathic physicians like myself had a mortality rate that was something like 10-fold or greater less than everybody else. And so what we learned from that was, if the doctors recommended, if you could move, go outside and get some fresh air and sunlight a couple times a day, 5 or 10 minutes. Doesn't mean go to your friend's house. It just means go walk around your yard or down the road and come back. Wave to your neighbor through the, and then the other part is, if you are caring for someone in close proximity or who can't move around as much, you can open the windows in the house and get some fresh air. You should probably be doing that anyway. And we talk about how the lymphatic system helps to drain things. And in the arms and the legs, we need muscle contractions to move those fluids out. In the thorax and the abdomen, we need to have change in pressure gradients from breathing. So one of the things osteopaths did was they would open the windows when people had the flu, and if they were really sick, they would have their family members with the patient lying down, shaking their feet in a rhythmic motion. And they would match the fluid shift, right, and you would biomechanically move the fluids up and down. So you could do this yourself. That's what rebounding is. Right. Right. And walking and jumping. And so it's not all that bad. I mean, to me, it's like the coronavirus thing is going to pass. Let's make it let's let it pass as easily as possible. But it is one of the positives out of this is it is an amazing opportunity for everybody out there to start taking care of the next step in controlling their health and resuming their personal responsibility for it right now. So
100%. That's so, and it's really interesting right now because, at least here in Portland, it's definitely quiet out there.
yeah,
And any runs that I've done on the trails, we were talking earlier about skiing, they haven't yet closed the mountain. And my husband and I went out there the other day and it was great. The mountain was empty and we had it basically to ourselves, but just getting outside, we've been sitting down and kind of strategizing now that the kids are out of school for, 2.5, they say, weeks, but we'll see if that isn't extended. And, just strategizing every day, like, let's take this opportunity to do family adventures. Like, let's go hiking, let's get out into the woods. Like that's the best place to be in many ways right now, is outside, breathing in good, clean air, and moving your body in whatever way your body is able to move.
yeah.
I think that's great.
Yeah, and one of the other parts that's super important, and I know you've sort of mentioned it a couple times, is I like to say chill out, because I'm just from New Jersey and that's what we do. But it's like it's a time to de-stress, and chill out to me seems a little more positive than de-stress. It's like, enjoy your time with your family.
Right.
Get back to enjoying life on a daily basis. And so if everybody could start their day and end their day with 5 or 10 minutes of gratitude and some form of relaxation, whatever it is for you, breathing, meditation, yoga, prayer, qigong, walking, riding, whatever it is, reading a book, drawing, find something that is not plugged into a damn piece of electronics, because we're going to be using that a lot to communicate. So let's just unplug a little and calm down, because it's like the sleep thing is so critical. And so a couple of things I've been telling people is, if we do things like breath awareness meditations or heart-centered breathing, right? It's really super hard, right? You breathe into your chest and you feel and notice that you're breathing into your chest. Like that's really that's pretty non-denominational and pretty easy, right? And so once you kind of just focus a little on breathing into your chest for a minute or two, and that your chest expands and contracts, or whatever you focus on, then think about someone or something you love.
Yeah.
And that's going to boost your immune system. But what's really cool is if you do this before bed, it improves your heart rate variability and allows you to sleep more deeply. You sleep more deeply, your brain detoxifies better, your body repairs better, your immune system is better. And so then if you go and do your walk outside in the morning with some sunshine, that's a pretty cool thing, because now we get our melatonin cycle started early in the morning, because we need natural light frequencies to boost our melatonin. And then at night, when it gets dark, because we've turned the lights off a little earlier or used our blue blockers, and now we actually can get to sleep. And so one of the tricks for people who don't sleep is to actually get up in the morning.
Yes.
And if you get up and go outside, you're already halfway to your whole daily, double time,
100%.
It's so good. It's just so good. But we need to calm down and really allow our immune system to chill. And another quick tip I love to share when we do things like this is turn off your Wi-Fi at night. Right? Like I use mine only when I need to, and then I turn it right off. We're not at the point where the whole house is wired, but part of it is, But what we know is that Wi-Fi and any of these electronics are able to stimulate, are stimulatory to the brain, and they're pro-inflammatory. We can't get away from them, but when we're sleeping, let's create a sanctuary that kind of calms that down. So if you just hit the button on the back of your router or unplug it, it should go off. And I have a lot of people put it on a timer.
That's great.
So it's like 10 o'clock it goes off, 7 o'clock it goes on. Set it, forget it, and you don't even have to worry about it.
Yeah, we do that. I was actually shocked at the difference that made. I'd been reluctant to do it because there's so many other Wi-Fis in the neighborhood that you turn off ours. I could still pick up Wi-Fi from like 3 other networks. And I thought, this isn't going to make a difference.
Total BS,
and we
right?
turned it off, and I slept so deeply that first night. And I was like, wait, really? And then we played with it, be like one night we'd keep it on, and it was across the board, not just us. Our kids slept better, like just like the kind of nighttime stuff that happens with kids. Like
dogs don't walk around as much. It's crazy.
It was amazing. So now I'm like, well, that's just house policy every night.
Yeah. And so one thing that people should be aware of is, for me, when I first learned about this, I turned it off. I did not sleep for 2 weeks. I was like all over the place. Everybody else in the family immediately slept better. I was like so light. because I never had a sleep issue.
Right.
And then it was like 2 weeks later, I'm back to sleeping great. I'm just no problem. And then like a couple weeks into it of feeling good, I was up all night. And I was like, a couple weeks later, I'm up all night again. And the third time it happened within like a month or two, I was like, maybe I left and I went downstairs and the Wi-Fi was on. I turned it off, I went to bed. And then, so like now it only happens like once every couple of months, but I'm like, why am I not able to go to bed? Wi-Fi is on 100% of the time.
That's so interesting. Yeah, we don't recognize all these things that are impacting us.
And it is important, if you were to get one of the tri-field meters and some of the other meters out there, a lot of people are like, well, Wi-Fi is not bad. I'm like, well, that's because if you stand there for 5 or 10 seconds, what it'll do is when you first turn it on, it tries to connect and it shoots and you'll see a big spike and then it'll go dead. But just stand there, just wait. You wait like 15 seconds, big spike, then it goes away. It's almost like that intermittent explosive disorder, the anger thing, where it's almost worse for you. It'd be better for you to be angry all the time than to be angry intermittently in terms of your heart and your blood pressure.
Right.
So, and the microwave does the same thing. Everybody's, oh, the microwave, yada, yada, it doesn't change your food. I'm like, yeah, turn on the meter, turn on the thing. You'll never turn it on again.
Right.
So just really thinking about, and it's not like, and it's like when we look at diet, I see a lot of kids, and despite the fact that I would like them to be perfect with their diet, a lot of them got an infectious exposure, and now they have a really severe medical problem, and we need to treat the infection. We're working on diet, but it was kind of like a boom, boom, and we have to just dive in, and the dietary stuff is going to happen over time. I'm working with a lot of coronavirus prevention and children the same way I do with the chronic stuff is, if your child is having 3 cans of soda a day, granted, you should be having 0. This is just given. But if they're having 3, just go down to 2.
Right.
Start somewhere that doesn't overstress people out. Because if we flip the dial to the other side 100%, our kids are going to go ballistic. They're already like going to be getting more screen time than usual. So you're going to be giving them a hard time to use less. They're not going to be able to go play with their friends for a little bit. We just have to balance here. And that's really, I think, a big part of it.
I want to ask, there's been this rush on toilet paper. And, it was a lot of funny memes around there about that kind of stuff. But, you see, and I heard at one point that like they're out of Hostess Twinkies or something. And you're like, oh, goodness, you want to invite the coronavirus into your home. That's a really good way to do
Twinkies.
it. Right. So what would you say about this sort of tendency to stockpile? And if one was to go, stock up on things, what would you be recommending they do? I don't think you can stock up on toilet paper anymore, even if you wanted to. That ship sailed.
Yeah, it did. And I think that I wish the whole country was having this conversation earlier. There's no need to have a run on toilet paper. So now a lot of us who are a little bit like my wife and I, we're pragmatic. We're seeing what's happening, taking our time. We're like, hope we have toilet paper because we missed it.
There's no toilet paper anymore. Yeah.
Right. Because we're not freaking out. So some of us are going to have to go to the store and get things when we see them, and maybe buy a little bit more. Like I just bought like 3 pounds of quinoa. Like I'm like, but it was like I could get a box that were 3 16-ounce things, and I'm like, well, it's available. I'll get it. But I'm trying to, but 3 pounds of quinoa I could live on for a really long time.
Right.
Like a long time. So, we're still getting our fresh fruits and veggies. We're going to be washing them a lot more than we usually do. And, there's tricks for removing pesticides and stuff with like, baking soda and water and stuff. But we don't know that that's going to do it with the virus. So again, it's soap and water actually works. So we may be doing that. We don't know what the right answer is, but definitely rinsing things off and washing our fresh foods. We're buying some meat and, we're buying a little bit of extra, but we're freezing it, but we're not like buying the whole counter out. Because we know what we heard from Whole Foods yesterday was actually that they're literally being rationed food. Wow. And so they can only receive and then only put out so much food every day. Wow. And it's basically to kind of pull back on some of the insanity. Yeah. The good news is the people who are working there is like, I don't know how we would ever need to, like, we're never going to overdo it, right? Like, we're not going to run out of food in any given day now that the surge for all the cleaning products is over.
Right.
So what they're saying is they're getting enough food, but they are taking their time. They're just taking precautions to make sure if there's no run on it. But
Right.
yeah, we just have to not freak. But it's hard, as we were talking before, it's really hard because other people around us are freaking. So we're relying, this is a time where the planet needs to come together. We're relying on other people so that we don't get sick and so that we have enough food. So you and I can do the right thing and we could be left out, right? And so we're finding a balance point. And that's why I really appreciate being able to have the conversation of talking about how significant this health pandemic really is, but also the things that we can do and lead. And all of us who are listening to this can share this with other people and say, look, let's calm down. You don't need a lifetime supply of toilet paper. There's not going to be, unless we all create it, there's not going to be a shortage of food. Right. It's just, we're going to have to get smart about ways to share, to go get it and to distribute it.
100%. I think that's just, I think, we talked before we turned the camera on about there's this balance between taking it really seriously. Like, this is unprecedented. We don't really know what the future holds, and we need to do everything in our power to mitigate the impact. And at the same time, freaking out is not helping really anybody. It's taking away resources from people who need it. It's not helping our immune systems. It's not going to protect us anymore.
Oh, no. Right.
And so it's really finding that kind of there's a term I like to use. I always strive to be unflappable. And, this idea of like things come and like, just be that even keel, keep the reason, do what it is you can do, and take full responsibility for your actions, while really doing everything you can not to freak out. And that is, I can say it, it's easy to say, it's very hard to do in this climate. I know I've had to manage how much I look, at first I was barely looking, and then I let myself go. And then, it's okay, now I'm informed, I'm going to do what I need to do. I'm going to follow the instructions of kids at home. We've become extraordinarily good hand washers in our household, which is fantastic. And
it's interesting because even yesterday, my wife and I, this is ever emerging and changing. And we had this conversation, like, what are we going to do with our patients? Because I see people virtually, but legally I have to see them all once a year. And a lot of my patients are sort of in the general region of my office, and they just want to come in and talk. Yeah. And we were like yesterday, like, well, what are we going to do? Well, we'll see some people, but not other people if they come from a high risk area. And I woke up this morning and I looked at the new numbers. I'm like, well, I don't want to say I predicted, I did, but so did a whole bunch of other people. 2 days ago, we had 50% less cases in the US than we do today. So we have to change our mindset on, I should say we need to change our strategies fluidly and on a regular basis. And it's great because now we get to be dynamic, creative thinkers. I get to introduce my patients to a new way to communicate with me. And, but it's hard because as a small business owner, I have a lot of people who are like, oh, I just want to cancel the appointment. I'm like, okay, well, if enough of you cancel your appointment in the next 2 weeks, I will never be here for you again. Right. And just because that's our primary mode is of making money and generating revenue is direct patient care. So it's one of these things where we can all just come up with lots of compassion and new ways to think. And it's like what we were talking about is like the functional medicine, integrative world, whatever you want to call it, natural medicine. We have a tendency to kind of poo-poo or even push conventional medicine away. This is a coming together time. This is a time where you're going to see that we need the best of both sides to come together.
100%. I think that's so critical. This is not an us and them kind of situation at all. We need everybody's best resources. And I think that's a critical thing. I have 2 last questions for you. One of them is logistical. For people to stay up to date, what do you think are the best places for them to stay current without getting overwhelmed in sort of the panic and hysteria? Like where do you recommend people stay informed?
Yeah, there's a couple of things. And I mean, it's so funny. Obviously I find myself pausing right now. the CDC and the WHO are doing a decent job of keeping us abreast of what's happening, right? It's not perfect. There is some spin. The WHO, though, they do have this really cool thing they call the novel coronavirus COVID-19 situation map. And the map is awesome. It really lets you see what's going along around the globe. They are relying, like, still today, we're a little bit behind because in the US because the CDC hasn't updated. The other one that can give people some sort of up-to-date information, I'm not sure it's 1,000% accurate, but it's pretty accurate, is worldometers.info.
Okay.
And so worldometers.info/coronavirus, and it'll break it down by country. And so you can go and look at the United States and see it's much more accurate with the information that's coming out of all the major news outlets and stuff in terms of the updated numbers. And they'll be up to date much quicker than the CDC. Now, some of the major news outlets are okay. The problem is, how do you figure out what's what? I've set up a resource center on our website where I'm going in and going over and over, giving people updates about what's going on. So people can have access to that at originsofhealth.com/coronavirus. And,
Perfect.
you know, I'm always, that resource page is always going to be 1 to 2 days kind of behind like the craziness of the regular media, because what I'm trying to do is digest what's happening and put it all together, because all the major numbers go to those other places.
Right.
You know, but like right now, I mean, we don't have a treatment, people are working on it. We don't have a vaccine, people are working on it. There are some, you know, really great natural things that we don't know if they do squat in COVID-19. But they work in other viruses, and they work to boost your immune system. So you can do kind of things like that. And I think too, a lot of doctors have been asking in some news outlets, what do doctors do? I'm like, well, we're going to do this just like we were trained. When you get a medical article or you get a nutritional article, you read it. You understand how to interpret data, and you also understand that the authors have a point of view that they're trying to share with you. CDC and the WHO have a point of view they're trying to share. So does CNN and NBC, Fox, and all these people. So as people who are able to critically review scientific literature and nutrition literature, we should be applying the same thing here. And that's like, you know, you put the common sense to it, you know, because the truth is somewhere between what everybody's saying. And the problem is, the way this is emerging so rapidly, what is truth 2 days ago is not accurate today. Right. Unfortunately.
I will put links to both of those resources under this video. It's very helpful. That's very helpful. And then my last question, which we talked about a little bit earlier, is, you know a lot about this. You're in it. And so what is it, you know, if you could kind of encapsulate 1 or 2 things that you just wish everybody else knew, whether it's because of misinformation, or just lack of information, like what is it that you know about the situation that you really wish everyone else really understood?
Yeah, that's a tough question because there's so many pieces. I think that the most important thing to understand, that everybody needs to understand, is that this is really serious. But that doesn't mean freak out, you know, and by remaining calm and taking that time to just follow the recommendations, you're helping not only yourself, but tons of other people. So kind of number 1 is, it's super serious, but we don't need to panic. We need to apply common sense to it. And that's almost an oxymoron and not even possible at this point. But the other part is a part that we spent a lot of time talking about, is that this is a time where we need to rely on each other to protect each other. The number 1 thing, all the things that you're doing are actually most likely going to help other people more than it will help you, with the exception of all the natural health boosting things that you've been doing, like whatever your supplement regimen is, and you're de-stressing and you're living life with gratitude and all that. That's going to help both groups, you and them. Yeah. But most of these precautions are actually, because I'm assuming most folks listening are going to be healthier and working in that already, you're actually helping to protect other people. And so when you talk to others, hopefully virtually or on the phone or whatever, or, you know, from a distance socially, or if you're, you know, is to say, hey, look, we're all doing this together to help each other. This is a time that the globe can come together. And it's like really interesting that this pandemic is like ripping everybody apart, but really what it's, you know, in the long run, I'm hoping it's going to bring us together more, because everything that you're doing that'll help you and your family is going to have a greater impact on someone other than you. And that is, I mean, you could look at that as a really bad thing or a super empowering thing. And I just find it so empowering that we actually need, in order for all of us to do well, we need to reconnect with each other.
It is. I feel like we're still so in it. It can be really hard to see the gifts in this kind of situation. But, you know, I heard someone just the other day say, you know, instead of it happening to me, this is happening for me. And I think if we can all adopt that and think of the gifts coming out of this ability to start really caring for each other, of unplugging, of learning the beauties of how to work from home, of getting outside more, of tucking in with family, and, just, we've brought out card games and board games that we hadn't brought
No, we
out.
did Monopoly yesterday.
Yeah. I mean, it's, there's a coming home aspect of all of this. So, not to downplay the severity of it, but I do think that in any huge challenge like this is where we get to tuck in and love each other up and really show some of the most powerfully beautiful sides of humanity. As much as some of the other stuff comes out, let's focus on what we can do and be a light for good in this.
Right. Yeah, it's great. It is. It's so crazy, but it's amazing to come together, and this will pass, I mean, it just the way it's looking. I mean, we've, as a race, as human beings, we've been through similar yet different things. We've never been so connected. The other part is we've never had so much information available to us during a pandemic.
Right.
So who knows? Maybe the other ones looked really bad and we just didn't know. We didn't test enough people.
Yeah.
But we'll get through it. And it's how we get through it is really the marker, and I do also think from a personal perspective, each of us, this drives us to take one more step in caring for ourselves. Because one of the reasons there's so much hate and disgust across the globe, in my opinion, is when we're getting away from loving ourselves and looking outside of ourselves for fulfillment. So as we start to come back into ourselves, I mean, this could be an amazing, amazing shift in humanity back righting the track, despite, my heart goes out to all the families who are impacted and all the people who are sick. So, but, and I know a lot of people have died but we have to honor those people and learn something from this to move forward. And it's going to help us all get this under control quicker.
100%. Thank you so much, Dr. Tom. This has been fantastic. I so appreciate you taking the time on a Sunday afternoon, no less. You are wonderful. Thank you. We're going to share your contacts and things below, and you're a fantastic resource page. We really, really appreciate you and all the work that you're doing.
Thanks for having me, and I appreciate all the work all you guys are doing too. It's such a great to be part of a big team together like this, and thank you.